This is the STL Medical Weight Loss radio show. With Dr. Joe, no more talking, let's go.
Welcome back to the STL Medical Weight Loss radio show. I'm your host, Dr. Joseph Moleski. I got my friend and co-host, Drew, here today. We're talking about needles, we're talking about weight loss, we're talking about changing lives. How about that?
Yes, that's a mic drop.
Yes, boom, changing lives. I love it. I'm passionate about this, guys. I'm passionate about helping patients reverse disease, essentially make their lives longer.
You are. I mean, that's the hope. I mean, obviously we don't know we can't confirm that.
Yeah.
but you're definitely helping.
Yes, and so the other thing I want to talk about is, I get this question a lot. So, Dr. Moleski, what happens when I get down on my weight, I reach my, ideal body weight? What's next? Do I stay on the medicine? Do I stop it? So I always say, a maintenance dose is what I recommend.
Okay.
A maintenance dose is a lower dose. So say you're on 7.5 milligrams or 10, you'd likely go down to 5 or 2.5. And we would see how you do over that month or two maintenance dose period. I typically tell patients starting back on that 2.5 dose, that initiation dose, to keep the cravings at bay, keep your weight down, still being conscientious of what's going in your mouth.
Sure.
I mean, it can't be like I reached my goal weight and now I'm going to McDonald's and Starbucks.
Yeah, you can't do that.
No, and so the maintenance dose is different for everybody, and I'm happy to work on it with you. But I usually start patients at a lower dose, and I usually say we can do it every week or every other week to maintain what you got. And then there can be that in between. You can have a 2.5 and then the 5. Maybe you don't want to do the whole 5. You can do a 3.
Mm-hmm.
And then that's your sweet spot, that where, hey, it controls my cravings, but I'm still able to keep down my weight. I'm not taking it every week. Maybe I take it twice a month, or I can take it 3 times a month. Whatever you decide, I'm willing to work with you. Marguerite Walsh, the PA that works with me, she's willing to work with you. We're very familiar with this maintenance phase. And we still see patients reach their ideal weight and then get on the maintenance dose, and they remain to be at that stable weight, their happy weight, that weight that they feel confident for months to come.
So many options. You know, people, if they want the 5 or 10 pounds, dose 1.
Yep.
If you want to lose a little more, let's go try dose 2. And then you work your way up to dose 3. And if you found your medium, okay, you found your sweet spot.
Yep.
There's options here, and you work with every single patient, and every case is different.
Correct. Yep. And some cases, you see it that these higher doses, a patient can only tolerate it for so long. They get the side effects. You kind of got to balance the side effects being mainly nausea. That's when I say side effects, it's just nausea. I mean, what it does is it slows down your GI system, your stomach. And so, you might have a little bit of nausea. You have to watch your meal size and what you're eating.
Sure.
But most patients, they have a little bit of nausea, and then it dissipates the longer you're on it. And anytime you climb up on a dose, so you're going from 5 to 7.5 or 7.5 to 10, just be aware, you might have some nausea.
So, and this might be another topic for a different show, with side effects. Mm-hmm. I have not really experienced anything. I know nausea is the #1 side effect for all these meds, but what isn't? And you've even prescribed a medicine for that for me. Never even had to touch it. I have it in my bag here at work, in case I had an issue.
Yeah.
But do people have these crazy wild side effects?
So what I can tell you is, like I said, nausea is the most common, but I see it probably maybe 3 out of 10 patients.
Really? Okay.
So 70%, I'm doing great.
Yeah.
I don't have any problems. The first 2 did, 2.55, great. I'm happy. I would say most of my patients, they're not having severe nausea and needing medications. But if you're like, hey, I'm worried about the side effects, I'm worried about the nausea, I'm happy to help. I can send the nausea med with the order if you want that, or I can call the prescription in to your pharmacy. It's Zofran essentially, and it's a common anti-nausea med. So don't feel like, oh, I'm hesitant, I don't want to do this because I might get nausea. No, we can provide something that can help with that.
Yeah, I just hope, and we can stress this now,
yeah,
don't let that be your holdup. Oh, there's going to be side effects, I'm not going to invest in this. we can treat that, people.
Yeah. And you know, my opinion is like, hey,
I can, you can.
Yeah. Drew's calling in scripts.
Dr. Drew over
Dr. Drew. This is a Dr. Drew show. But needless to say, you know, having patients concerned about the side effects, you know, looking at Tylenol, looking at, you know, Benadryl, looking at any even over-the-counter meds, there's side effects with everything. I mean, cholesterol meds, increase your risk for diabetes, and they don't really work that well. And so I guess what I'm trying to get at is any medication, folks, there's side effects. They're printed on the label. They read it off to you on you're watching TV. It can cause, you're like, oh my God. But
the fine print.
Yes, the fine print. But what I think the biggest thing that we need to talk about is, hey, if there are side effects with this medication. The ones I see, a little bit of constipation at times, sometimes actually a little bit of diarrhea. Most common is nausea.
Okay.
We have meds for that. It can help. And if you're constipated, you can take over-the-counter Miralax that can help loosen your stools. So we are able to give you the education to get through those. And don't let that stop you from investing in yourself. And the one thing I can say too is like, so say you try a month and it doesn't work and you're like, I have severe side effects. Then we just stop it. I mean, that's with any medication.
At least partner with you then.
Sure.
You know, at least let Dr. Joe know what you're seeing, what you're experiencing, so you can, I keep saying so you can note that.
Yes.
You know, and maybe find a way that it can still work.
Yes.
The lower dose, or find that happy medium that will still work for
Correct.
you in this process.
And I've had that happen multiple times where I have a patient that, you know, the medication just, you know, it was too much, where, you know, they wanted to go down on the dose and they got back down and we worked out a dose and then they're able to stay on it. They're able to lose their weight. So we're willing to work with you in any capacity. Any questions are fair game, and don't ever feel like, oh my God, I'm worried about, you know, asking this, or I'm worried about, you know, side effects. I'm worried about the needle. Hey, we're here to just talk to you. It's a, you know, you book online. If you have, we can answer any questions and get you feel comfortable with starting this and starting the process of changing.
You don't know what you don't know, and you won't know if you don't ask.
Correct. And, you know, we're here to make sure that you feel like you're part of, like, the family, we call it, or even part of just building a friendship. I know we have the patient-doctor relationship, but I want to take that to the next level. I want to get patients to where they feel comfortable enough, like they're talking to their best friend or neighbor, that, hey, I'm here to make sure that you're successful, we're successful, and at the end of the day, you're not, you know, 10 years down the road in a hospital bed because you didn't pay attention to your weight and now you have high blood pressure and developed a heart attack.
Well, I appreciate you. I know final minute now, but just thank you for what you're doing. And I just encourage everyone to give Dr. Joe a call. He will give you the info and he can save your life.
And I totally agree, Drew. Thank you for that. And the best way to get an appointment set is to book online, stlmedweightloss.com, or give us a call at 636-628-6604. Until next time, guys, stay healthy out there.